Well, by now we probably all know somebody who's been impacted by COVID-19, but maybe not to the extent of the man you're about to meet. In today's Your Healthy Family, I'm introducing you to Sean Hanley. He's 53 years old, no underlying health conditions, and now an artificial lung is keeping him alive. We do want to warn you, this equipment oxygenates Sean's blood, so you do see that happening in this video.
How are you feeling? I mean, I know that's a loaded question.
If you take away all this stuff, okay.
I met Sean Hanley just days after he was able to talk again. But there was a time doctors thought Sean might not make it through his COVID-19 diagnosis.
When we met Sean, Sean came from an outside hospital. He was on severe respiratory failure. He was on the ventilator already.
That was close to 10 weeks ago. Dr. Gaston Cudemos, the chief of NCH Healthcare System's cardiovascular ICU and the director of its ECMO program, says Sean was in a medically induced coma. He was brought to NCH to see if he'd be a good candidate for ECMO, or extracorporeal membrane oxygenation, a form of life support, essentially an artificial lung, doing the work for Sean's lungs so they can recover.
We put him on ECMO shortly after. And then the process started to get him off the coma, decreasing the amount of sedatives, being careful to protect the lungs and the rest of his organs.
And he says the fact that Sean is awake lets him be a part of his own recovery.
The ability to be able to talk to him, help him in this painful process, have him interacting with the staff, the ability to work with physical therapy. That's all part of the aggressive physical therapy regimen that we have.
Dr. Cudemos says it's a process that takes time and an entire team to make happen.
Words can't describe how grateful I am. The doctor is the quarterback, but the real help is from the nursing staff and all. Unbelievable support that they've given me.
The goal is to help Sean's lungs recover from the havoc of COVID-19. But patients whose lungs can't recover are on ECMO until they can get a lung transplant.
He's working every day to try to get him stronger. And we're extremely happy about that.
Sean tells me he didn't want to get the COVID-19 vaccine.
I made a bad decision. I'm paying for it.
And from his hospital room, he has a message for anyone watching right now.
If they say get vaccinated, get vaccinated. I mean, the symptoms are different for everybody. Unfortunately, I got a bad strain, and it's literally almost wiped me out.
So glad to see him recovering, and we do thank Sean for sharing his story with us. Now, over the next couple of days, we are going to show you how the artificial lung works and keep Sean alive while his lungs recover. We'll also introduce you to the team of people taking care of Sean at NCH. With today's Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.